Hello, and welcome to another Spotlight to Science, where we get to meet the researchers who have received funding from the American Diabetes Association. My name is Marlon Pragnell, and I'm VP of Research and Science at the ADA. And today we'll be speaking with Drs. Jordi Merino and Sara Cromer. Dr. Merino is an associate professor and group leader at the Novo Nordisk Foundation Center for Basic Metabolic Research at the University of Copenhagen in Denmark, and he received his PhD at the Rovira and Virgili University in Spain. And Dr. Sara Cromer is an assistant in medicine at the Mass General Hospital in Boston and also an instructor at Harvard. And she received her MD from Baylor College of Medicine and did her internship and residency at the New York Presbyterian Hospital, Columbia University Medical Center. And they do some fascinating work on the intersection between food and diet, dietary choice, and genetic variability between individuals. So welcome. Sorry, I have a bit of a... Welcome to both of you.
Thank you very much, Marlon.
Could you, Jordi, maybe start and just give me an overview of the work you're doing?
Yeah, definitely. So we're interested in why people eat what they eat, when people eat, how much they eat. So we're interested in understanding what drives diet and which are the consequences of different diets to the body. And of course, it has been a lot of research interest in understanding the roles of diet with metabolic diseases and cardiovascular health. But the reality is that not everyone responds similarly to diet, and that there is a huge variation in the effects of dietary factors on health outcomes. So that was the base to propose a research program to understand the determinants of diet and how different diets influence health of different people.
And then the genetics component. So apparently that we have a social environment, the food that we see around us influences our dietary choices, but there's a genetic component to that too, right? So you've actually, some of your research or your early research suggested that there may be some kind of genes or combination of genes that might indicate or kind of influence the way we eat, what we choose.
Yeah, exactly. Just think in an ice cream shop. If there were no difference and no variance in preferences and what people eat, maybe we will just have one flavor and everyone will go to that flavor. And the thing is that we are so different. We are so different in many aspects, from our biology and our genetics to our composition of the gut microbiome, to our cultural differences, to our preferences. So genetics is, again, one of these factors that predispose people to eat more things, more one particular thing or the other thing. So a nice example on how genetics influence our preferences is with the cilantro story. So there are a certain amount of people that cilantro tastes as soap to them, and this is because they carry a genetic mutation that makes the perception of cilantro like soap. So it's very important, and it's been known for many, many years that genetic differences drive what we eat, how much we eat, and what we prefer. So it's a very, very fascinating topic. And of course, we are just scratching the surface in understanding the genetics and the molecular component of eating preferences and eating behavior, but it has a lot of potential to understand why people eat certain amount of things or why people are more addicted to one thing or the other.
Interesting. So, for example, like a study, like you mentioned cilantro study. So how do people find that? How do you go about doing a study and ultimately find out that some people taste cilantro as soap and their genetic components? So what's involved in that?
So yeah, it's a very interesting story and involves having a lot of people responding to questionnaires or testing foods and then ask for the perception. And then, because we have access to large data sets in which we have genetic information and other relevant information, we can start teasing out these kind of associations and elucidate on the mechanisms of why people prefer one thing or the other. So it's it's been known for many, many years that, for example, sour, salty, sweet foods are more likely to create more reward to a specific group of individuals or others. And it's now with access to large amount of data that we can start understanding these associations.
So you know there are genetic components to this. For example, again, come back to the cilantro idea. So then there are genes involved, but then how do you find out the genes? How do you get to the point where, oh, this is what's causing it, or that's what's causing it, or what's the steps that are involved in doing that?
So it's complex, and usually we do this based on large scale data sets in which we have genetic information, and then it's trying to understand the phenotype with the genetic variation. And of course, you can look at many genes and many positions in your genome, but in a study that includes many thousands of individuals, if there is a small signal, you are able to capture that signal. And then it's narrowing down where this signal comes. And then often we do additional studies to understand what it is in this genetic region. And then sometimes you need animal models and experimental models to knock out this gene and see what happened with this animal model. So it's a lot to understand the genetic variability from these early genetic associations. But we can do today these kind of experiments and to try to understand the biology that underlies our preferences and how people respond to foods and how people interact with foods.
Mm-hmm. And so you're doing something similar with diet then. So how do you go about getting dietary preferences and so on? I mean, what's the process there? How do you get these people together? How do you assess them? How tell us more about that.
Yeah, it is fascinating because the research field has really exploded over the last 5-10 years, and we are able now to have access to thousands of individuals in which we take a blood sample, and then with this blood sample we are able to get genetic information, and then we administer questionnaires to these participants. We ask them, how do you like this kind of food? What do you prefer to eat, this food or this food? Which one of these foods creates you the most aversion? So by asking these kind of questions in thousands of individuals, then you can link the information that is in the blood with the information that they respond. So it's fascinating. So for example, in the UK, we have data from about 0.5 million people in which we have genetic information and that we have information about food preferences, food liking, and things like that. And now in the US, we are building a research program that is called All of Us, which will include 1 million people. And in this 1 million people, we will have genetic information and we will have information about their food preferences, their lifestyle, their habits, and then we can begin understanding these kind of associations.
Mm-hmm. Yeah, for like genetics, we also hear like cystic fibrosis, a single gene, and like causing a disease or so. But my understanding is that these are more complex. Many genes are involved. And I noticed from your writings that they're like 90-something different locations on the chromosomes and so on that may be associated with kind of this choice of food and so how do you kind of how do you use that so many points of information, and how do you kind of integrate that and decide what to move forward with in terms of explaining what's going on?
Do you want to take this one, Sarah?
Sure, happy to. So when you give the example of cystic fibrosis, that's an excellent example of a monogenic disease, which is caused monogenic by one gene. There are a number of other good examples of that, and there are even monogenic causes of diabetes. But in most diseases, most even just differences between people are actually polygenic. And a good example is height. Our height is not controlled by one gene. It's controlled by many genes across the genome, and that each make very small contributions that make our height a little taller or a little smaller. And then, of course, it's also included or influenced by dietary and other lifestyle things as we grow up. But the fact is, as I said, that most diseases and most traits are polygenic. And so the field of genetics is really moving to try and understand kind of the polygenic or the whole genetic risk of various diseases and traits. And Jordi has been a little humble so far, but I really want to highlight some of his earlier work that led to the work that's happening now, which is creating polygenic scores to understand whether people prefer different types of food, and specifically what we call macronutrients, so carbohydrates or fat or protein. And he had done a lot of work prior to this current grant trying to understand what genetic factors or what genetic locations were associated with preferring, for example, a high carb diet or a high fat diet. And that's kind of the groundwork that led to what we're working on now.
Interesting, yeah. So you have the genetics, but then, you also have the environment, your social context, and so on. I suppose that there's a certain amount of a dose of one aspect versus the other, and they're competing. And how do you know what comes from where? And can you overcome your genetics, or how do you kind of identify how much of the genetics, the contribution of genetics, and how much that tweaking that will actually help you kind of identify a better diet for a person?
So that's a fantastic question, and that is the goal of our current research. What we're hoping to do with this grant as a whole is understand how your genetic factors that influence whether you're interested in carbohydrate or protein or fat, how those interact with various elements of the environment. And so in this grant in particular, we're looking kind of at 3 different areas that might interact with the genetics. In the first part of the grant, which Jordi had recently completed, we looked at whether people who had carbohydrate or protein or fat preference in their genetics responded differently to an intervention in the workplace that tried to educate people about how healthy different foods were in the workplace. So there was a traffic light label system where healthy foods were listed as green, less healthy foods were listed as yellow, and unhealthy foods were listed as red. We looked to see whether your genetic preference influenced how you responded to getting that information about your food preference. And then in later portions of the grant, we're trying to understand how your genetic preference for carbohydrate or fat interacts with how you eat and what foods you prefer and how your body responds to those foods. So for example, if you have a strong preference for carbohydrates and you eat a carbohydrate dense meal, does your blood sugar go higher than someone who has, a carbohydrate preference who eats a fat dense meal? And then in the last part of the grant, we're going to be working really hard to understand how the genetic preference for carbohydrate or fat interacts with socioeconomic status and other elements of the environment that can make it difficult to eat one way or another, or difficult to eat healthy. And the way we go about that is very complex. It involves a lot of statistical analysis, but there are ways that you can tease that apart and try to understand, what percent of your dietary makeup is determined by your genetics versus what percent is determined by your socioeconomic status, for example.
So this is in a sense like precision medicine, right? So precision diets, right? Precision guidance in terms of how to go about your life and how to eat the best and avoid certain things. And I mean, essentially that's, if I understand correctly, you'll have a kind of a kind of say makeups of people, so to speak, based on their genetics and maybe their environment and so on, that you can kind of channel them in a healthier path. Would that be more of a kind of assessment, a correct assessment?
Yeah, there is this whole branch on precision medicine that's called precision nutrition. It tries to understand what is the right food for the right person at that right time. And of course, when it comes to foods, it's very difficult because we always made hundreds of decisions per week, per month on the foods that we eat. So when we englobe this diet concept on dietary patterns and ways that we should be eating, there's a huge potential to target diets to how people respond to that diet and the differences that they have in their body that make them respond differently. But also, as Sara was mentioning, based on the sociocultural differences that people have. So I think that those days, this dichotomy between genetics or environment, it's a little bit old-fashioned. We try to understand it as an integrated common ground that it's making people respond differently to diets and also to get different outcomes from these diets. So, of course, the environment has a huge impact on the way that we eat and whether we are more likely to develop several conditions. But it's also true that our biology makes us to adapt to our environment and make us to eat or respond differently to different things. So trying to understand this integrated component between environment and biology, it's critical to advance the prevention of one of the most complicated diseases as diabetes. So we feel that a better understanding of the situation could make an impact.
Yeah. And so The study you've mentioned, you're making quite good progress. Obviously, you have a long way to, a lot of work left to do, and so on. But where are you at now in your in the studies?
So we just completed one of the main tasks that we proposed in this research proposal, and was to identify whether individuals at different genetic preference for carbohydrate or protein or fat are more likely to choose certain types of foods or others. And we completed that, and it's about to be published. So we are now working very hard on the second and the third aim. The second aim is a recall by genotype study. It's a study in which we invite participants in the clinic. We gave them a carbohydrate-rich meal, and then according on their genetic susceptibility, we are looking at how they respond to this meal. And we're about to complete enrollment, and then we collected blood, and we have a lot of determinations from these individuals that we will do more in-depth profiling. And then for the third aim, in which we try to integrate the social determinants of health, the environment with the genetic susceptibility, we are just getting started, and hopefully we can start implementing the analysis that we are envisioning soon.
Nice, nice. You know, we see a lot now in the news about obesity and new drugs and GLP-1. You know, all of these therapies that are coming out, and it strikes me that if you're doing research in this area and you see kind of difference in choice of foods and so on, I'm wondering if any of those pathways that are relevant to this GLP-1 incretins and so on might be also something relevant to the choice of food and dietary kind of genetics and so on. Are you seeing kind of anything there, or because I mean, thinking one thing too is, you know, as you start to look at the genetics and so on, there may be kind of like hints of future drugs or certain pathways to kind of start kind of looking at in ways that you could tweak, not just behaviorally and just in terms of understanding risk, but also to maybe manipulating therapeutically.
I can maybe take this one. So in the GLP-1s, what we see in practice in our clinics with medicines like Ozempic or Victoza or Trulicity is that they influence the way people eat in a number of different ways. The most prominent is that they do slow down your intestinal movement, which allows food to stay in the stomach for longer and allows people to feel full faster. And so people in general will eat less and will feel less hungry between meals. But what's very interesting with GLP-1s is that they affect many other areas of the body, not just the stomach, not just the liver, not just the pancreas, not just the heart. They also have effects on the brain and some of the kind of pathways in the brain that can influence taste and taste preference. And there were actually studies in I believe either mice or rats where they gave the animals GLP-1s and gave them the option to eat either regular healthy rat food or to eat Nutella. And without the GLP-1s, the rats were very happy to eat the Nutella, but when given the GLP-1s, they actually switched and started eating healthier food. And I've had patients come in and tell me as well, like, oh, I've lost my sweet tooth, or I've stopped craving, fatty foods. So there is some way that GLP-1s interact with taste. That I would say that's not a main focus of our work, but we do work within a broader group underneath Jose Flores that focuses on precision diabetes in general, but also on specifically how your genetics may impact your response to medications, because some people respond very strongly to one medication and not as strongly to another. Whereas, someone else may be the opposite. And so we're part of a wider group that's working on exactly that question.
That's great. Cool. So how, let's say that you at the end of the funding and then the grant and obviously the research that you're doing, how will this ultimately impact a person with obesity or diabetes, or what kind of, in the future, let's imagine the ultimate goal, how would this impact a person with diabetes or obesity?
It might impact in several ways. So, for example, if you know your genetic predisposition and then you know that you are more vulnerable to high carbohydrate diet or high fat diets, you then have actionable knowledge to improve that. It might help in terms of targeting a diet to a specific genetic susceptibility. Imagine that you have higher genetic preference for carbohydrates, and then when you eat carbohydrates, you do not experience a very detrimental response. So maybe a diet that it's not as restricted in carbohydrates than other diets could work for you. There is also the potential to understand the links. This is what Sara was mentioning, understand the links between our gut and our brain, and then try to target things that could increase the satiety perception or reduce the food reward or reduce the sweet preference. So by understanding how these genes work, doing these kind of experimental studies in animal models, we can even start identifying potential drug targets that they will need much, much more work and much more sophisticated analysis and experimental work, but maybe this is the first step to identify something. So there are many, many possible ways that our results could make an impact to people living with obesity or people at a higher risk of diabetes.
Well, it's quite fascinating work and certainly very topical right now. And with this epidemic of obesity and diabetes, this is incredibly timely to understand all the issues around food choice, dietary choice, the differences between people, and how best to kind of guide people along the right path based on their individual genetics and environment. And so it's quite absolutely fascinating. But thank you so much. This has been a very educational and informative conversation. And I wish you all the best in your research. And thank you so much for your time. This has been very interesting.
Very nice to talk to you. Thank you.
Great.